Hello, everyone. Thank you so much for joining the National Governors Association webinar on messaging for success to advance youth mental health. My name is Jordan Hines, and I'm the program director for the Children and Families team. As a reminder, please be sure to stay on mute until we reach the discussion portion of today's convening. We will be recording today's presentation, and you'll be able to find the recording of this webinar on our Chairs Initiative website as a permanent resource. I will now turn it over to our Center Director, Tim Blute, to open us up.
Thanks, Jordan, and good morning and good afternoon to everyone. For those of you I have not met, my name is Timothy Blute, and I'm the director of NGA's Center for Best Practices. The Center for Best Practices is the state policy team at the National Governors Association. We're a 501c3, providing bipartisan support to our nation's governors as they work to address their policy challenges in their states. And one of our top priorities this year, actually going back to last summer, so for the summer of 22 through the summer of 23, is our Chairs Initiative, which is an initiative of New Jersey's Governor Phil Murphy, focusing on strengthening youth mental health. We've held a series of events around the country focused on 4 pillars to strengthen youth mental health, including resilience and prevention, stigma and awareness, access to affordable treatment and care, and then finally caregiver and educator support and training, which is actually the theme of our roundtable coming up just next week. And this will all culminate in July of this summer, where we'll release a playbook for governors focused on policy interventions to strengthen youth mental health. Today's webinar fits really perfectly into this year-long initiative and really builds on the foundation of the work that we've completed thus far. We hope you'll find this to be a valuable tool as all of you dive into this playbook when it comes out, and hopefully you'll get a lot out of this webinar today on messaging and communications. And thanks to our friends at Frameworks Institute for joining us and presenting on today's webinar. So to kick us off, we're honored to hear a brief video from the great First Lady of Utah, Abby Cox. So let's get that queued up.
Hi, I'm Abby Cox. I'm happy to join you to briefly discuss the subject of clear and intentional messaging as we work together to advance youth mental health. As the First Lady of Utah, I absolutely see the impact that messaging can have on this critical issue. Strengthening the mental health and well-being of youth is a top priority for us in Utah and for governors and first spouses across the country. The COVID-19 pandemic led to a significant rise in loneliness and isolation, especially among children. In fact, at any moment, half of Americans are experiencing a significant, measurable level of loneliness. Half of the people on this call, half of the people at the grocery store you'll stop by tonight, and half of your children's classroom peers. This is devastating, and this is why it is more important than ever to focus on youth mental health. Here's the truth of it. The statistics are startling. 1 in 5 children suffer from a mental, emotional, or behavioral disorder in a given year. Suicide is a leading cause of death for youth, and 50% of all behavioral health disorders emerge in a child before age 14, with 75% emerging before age 24. We know that childhood is a critical time for intervention, and that connecting children and their families early can make all the difference. It's essential to have a clear, consistent, and compelling communication as we work on this issue, because children really are listening and paying attention. We recognize the high stakes of miscommunication. Families can feel alienated or overwhelmed, or children can feel hopeless, or we can lose momentum on these life-changing initiatives. State leaders and community leaders like you have an incredible opportunity to champion programs that save children's lives. My initiative for the state of Utah, Show Up, knows the importance of working and focusing on these problems upstream, whether it's using our service and volunteerism approach, connecting children of all abilities through sports, and addressing early childhood mental health. Unique to Utah is our Safe UT app, which is a statewide crisis and text tip line for students. This app has been instrumental in helping Utah students access mental health resources and support when they need it most. It has been a valuable tool for schools and families to identify and intervene in potential crises. We have implemented school-based mental health services in hundreds of schools across the state over the last few years, and that number is growing. These services provide students with access to licensed mental health professionals who can help them address a wide range of concerns. In addition, we have worked to reduce the stigma around mental health through public education campaigns such as the Live On campaign. Live On has been successful in raising awareness about suicide prevention and promoting positive mental health practices. The campaign has reached thousands of Utahns through social media, public events, and partnerships with local businesses and organizations. By emphasizing the importance of social connectedness and community support, Live On is helping to create a culture of mental wellness in Utah. We know that there is still much to be done, but we are committed to continuing our efforts to strengthen mental health and well-being of our youth. I want to thank you all for your commitment to youth mental health. Let's continue to work together to promote clear and intentional messaging and to ensure that our children receive the support and care they need to thrive. I am sure that today will be an important step in the right direction. Thank you.
All right, so we are thrilled to be able to share these perspectives from Utah. And I also want to flag that we are just so pleased to have such fantastic leadership here at NGA and have such great engagement. And we are also pleased to be joined today by Delaware's first spouse, Tracy Quillen-Carney. And now to our main act, I'll let them introduce themselves. We're excited to be joined today by the Frameworks Institute. Frameworks is a think tank that helps mission-driven organizations communicate about social issues in ways that build public will to support change. They have a wealth of knowledge and valuable resources, some of which you can find on their website, as you can see here. We're grateful that they can share their expertise with us today and are excited to hear their insights on youth mental health messaging. With that, I will turn it over to Nat and Marissa from Frameworks.
Well, thank you very much, Jordan. I'm going to share my screen really quick here. Give me 1 second. Make sure I can still see you guys. All right. All right. Someone give me a thumbs up. Okay, good. So you can hear me, you can see my screen. It's really great to be here. That was a great way to set up this conversation. I really appreciate First Lady Cox's comments there. So my name is Nat Kendall-Taylor, and I'm joined by my colleague, Marissa Gerstein-Pinot. And we're really looking forward to this time with you all today and have two pretty straightforward goals, one of which has already been mentioned. But the first goal is to be helpful. So I hope that we can take work that we've done, thinking that we've done, related to kind of how best to frame and position messages about youth mental health and bring that into the work that you all do, the important work that you all do, in a way that's helpful and that adds some value to your efforts, that gives you maybe a small and maybe slightly different way of looking at a really important part of what you all do, which is the choices that you make and how you communicate about this issue. And the second goal is that I hope Marissa and I can do this in a way that is humble. We don't do the work that you all do. We're not on the ground communicating about these issues in the kind of environments that you are. And again, the hope is just that we can kind of come into your conversation, come into your work, and add some value to it while being really respectful of the challenges that you all face. So with that, I'm going to tell you a little bit more about myself, not because I think you care or should care, but the kind of work that we're going to be talking about today is actually really related to my background and Marissa's as well. So I am, by training, what's called a psychological anthropologist. And what that means is that I'm really interested in, and for the last 20 years, have been studying the way that culture influences how we think. How we use culture without knowing it to process information, to make meaning of messages, and to formulate and reach decisions. And Marissa and I do this work on kind of culture and understanding with about 25 other folks who are social psychologists and sociologists. Marissa's a sociologist, people who are kind of study linguistics and political science. And we're really interested in our work at Frameworks in two things, both of which I'll be talking about here today. So the first is that we study deeply and think a lot about the way that people use culture to make sense of, in what we're talking about today, issues of youth mental health. So not kind of like what they know about rates of suicide or incidents of depression, but really what are the underlying patterns that they draw on without knowing it frequently, to make sense of these issues, to come to the way that they support solutions, to become engaged and willing to participate in addressing this issue. And second, we're interested in the way that the choices that we all make as communicators influence those mindsets, influence how people think about these issues, shape how they kind of interpret and take on information, and the decisions that people make as a result. So I'm going to start with the way that I always start presentations, which is by defining this term that we're going to be using ubiquitously for the next 30 minutes. So when we say framing, it's kind of one of these words that gets thrown around quite a bit. And so it's really important to tether and ground ourselves in a shared definition, again, at least for our time here together. So when we talk about framing, what we're talking about are the choices that we all make in how we present information. And so those can be like really big, obvious choices, the values that we evoke to explain why an issue matters, the metaphors that we use to explain how complex social or policy issues work. But importantly, it can also be much more subtle and nuanced decisions that we make. It's in the pronouns that we use. Do we talk about they, them, those people over there, or do we talk about we and our? It's in the verbs that we choose, and how certain verbs, especially when it comes to young people, can deny people agency and power, or extend and grant agency and power to groups of people. So it's all those choices, big and small, and how we present our ideas, and how those choices influence how people think, kind of how they understand our issues cognitively, how they feel emotionally, how people are willing to or unwilling to engage with our ideas and solutions. And then importantly, how people act, kind of the way that what we say can influence people to action, can influence behavior, can increase support and motivation to be part of solutions. And so I realize this is a little bit abstract. I'm going to make it much more concrete here for a second. I'm going to tell you about an experimental study that we ran with a longtime partner, the Harvard Center on the Developing Child, which has for a very long time struggled with communicating issues of child mental health, kind of convincing Americans that young children can have meaningful states of mental health, and kind of increasing or getting people to be supportive of the kind of evidence-based policies, practices, and interventions that support solid and stable mental health. So we've been working with them on this. What you see on the screen is one small part of a much larger body of work, in which we were tasked with kind of helping them figure out how using values in this case could be part of more effective, more engaging, more persuasive communication on this issue. So this is an online experiment. It's conducted with about 6,000 Americans to be representative in all the demographic categories that you can think of. And the way that this works is each of these 6,000 people log on to the experiment, and they get randomly assigned to one of 3 different groups. So Abigail, you log on, you get randomly assigned to read this message that's about collective progress and social prosperity. That's a frame you see on the lower part of the screen. And you would read about 80 words that's about a child mental health intervention, a program, an actual program, except the first sentence and the last sentence of that prompt, of that thing you're reading, sets this frame or this value of collective progress and social prosperity. So you'd read something like, it's important that we do a better job of addressing children's mental health because, and we wouldn't say it in such a cliched way, children are our future, right? They're solid, stable mental health, their healthy development is vital to our ability to move forward as a society, to experience progress and prosperity. Jordan, you log on, you get randomly assigned to the other message. So you read the same 80 words about that program, except the lead in and the lead out are different. So you'd hear something like, it's important that we do a better job of addressing child mental health in this country because children are our most vulnerable citizens. They deserve our empathy, our compassion, and we must do better by the most vulnerable members of our society. Timothy, you log on, sorry to say you get nothing. You're the thin 0 line that we see running across. Sorry, Timothy, we've never met. This is really rude. You're the zero line that we see running across the screen. You're the control condition, right? You're the thing that we use as a comparison. And then everybody answers the same set of questions, whether you're in the control and got nothing, or whether you're Abigail or Jordan who got these different messages. And so what you're going to see on the next screen, and those questions are designed to measure how supportive you are of a set of, in this case, 15 evidence-based programs, interventions, policies that have been shown to buttress to improve children's mental health. So what you're going to see on the next click are what I, and I think Marissa, think are two absolutely gorgeous green bars are going to appear on the screen. Those green bars are going to show you the extent to which hearing these frames affects people's support for the policy. And so I don't know kind of the statistical acumen of this group. So here's like a lesson in stats, everything you need to know. Up is good and down is not good. So when you see the value that Abigail received is boosting people's support for these policies. It's making people more willing to demand, to support these kinds of solutions. Unfortunately, Jordan, the value of vulnerability that you received is having the opposite effect. It is depressing people's support for these policies. So just to translate that for you, if you're an expert or an advocate or someone communicating about child mental health in this country, and you use the value of vulnerability as your lead frame, you not only waste your breath, which is the zero line, right? That's no message. You actually use those valuable communications resources in a way that directly disadvantages your goal as an expert or an advocate. Now, the picture here gets, depending on where you sit, more interesting or depressing in a piece of research that we did after this that looked at all of the field's external facing communications over a 3-year period. Guess which value we found to be the case to be used as kind of a lead argument in over 90% of those communications. So you all are on mute, so that has to be a rhetorical question. It is this value of vulnerability. So again, using valuable resources in a way that not only achieves no effect, but achieves an effect that is directly opposite to the intention of this field of advocates, policy folks working on this issue. So we've come to use this metaphor of a key for framing these decisions that we make, in that the decisions that we make, how we position our information, all of these choices has the ability to open up space to kind of create channels of productive communication, to bring people into the conversation and to invite people to consider new solutions. That's the good thing that a key does. We also know that keys do the opposite thing, right? Some of the choices that we make can shut down conversation. They can leave people to shut the door, sometimes literally in our faces. They can lead to message rejection. They can keep people from coming in and being open to a productive conversation and consideration of the solutions that we know are so important to advance. So why do we need this framing? And it kind of comes down to this situation that, if we're being honest with ourselves, everyone on this call has been in at one time or another, either professionally or personally, where we think we have the perfect way of talking about our issue. We think we have the perfect way of talking about youth mental health. We try it out with two of our closest colleagues who are also deeply committed and have a high degree of passion for addressing youth mental health, and it is awesome. And then we find out when we take that message out to normal people, right? People who don't live and eat and sleep and breathe our issues all day and our commitments as we have them, one of two things happens. So that thing that was so gripping to us and our two closest colleagues isn't for most people, right? It goes in one ear and out the other. It doesn't resonate, doesn't get traction, doesn't have grip, any of these things that we need. The second thing, which is frequent and more unfortunate, is that thing which sent us and our two closest colleagues running to demand more resources, more support for young people, sends the people we're communicating with in the exact opposite direction, towards more importance of individual responsibility, towards more bootstraps, towards more grit, drive, resilience, and gumption. I'm going to give you an example of what this looks like. Again, this comes from not directly from youth mental health work, but work we've done on early childhood development. So I imagine many of you all on this call are frequently in positions where you're communicating about early childhood development as well. Folks in this field want to, for good reason, talk quite a bit about adversity and stress. They say things like this. This is a direct quote from a developmental scientist that we work with. that persistent stress can derail development and have negative long-term effects on health and well-being. And so for folks who work in this field, this is like really true, right? It's like truthity true, all the way through true. Lots of research across a long period of time, number of disciplines, which shows this to be the case. Unfortunately, when this kind of message goes out to people who are not developmental scientists, one of the very, or perhaps most frequent reactions, most frequent things that we hear are things that look and sound like this.
Life's hard. It's supposed to be hard. You know, what doesn't kill you makes you stronger. You know, all the bad cliches you can think of. I mean, there's been people that have come from absolutely nothing to make it in whatever society's eyes deems success.
So it's a little hard to hear. This interview was on the side of the street in Tucson, Arizona. So I'll just make it crystal clear. That what we just heard, right? What doesn't kill us makes us stronger was not the intended takeaway when this expert opened his or her mouth to deliver this message. So something's going on here. Something is creating a difference between the intended effect, the delivery of the message, and the actual effect that it's having. And that thing, not to leave you on the very edge of your seats for a second longer, is culture, right? Culture, not the kind of Indiana Jones external artifact archaeology kind of culture, but rather culture in mind, culture as a set of shared mental models, of assumptions, of patterns of reasoning that we have and that we use to make sense of the information that we receive. And so these cultural mindsets, as we've come to call them, my people, anthropologists call them cultural models, but kind of in our field, they've started to become cultural mindsets, have three really important characteristics. So first of all, they are implicit. We are using them to understand information, to make decisions, to make meaning without knowing that we are using them. Second, they have this profound, as you will see throughout the rest of our presentation here, they have this profound effect in shaping how we see the world and how we make decisions in it. And last but not least, the choices that we make in how we communicate selectively activate certain mindsets and deactivate other mindsets. So they shape how we see the world, but they become active in our minds based on the information that we're receiving and cues in that information. So Marissa and I are going to spend the rest of our time talking about these three cultural mindsets that in our work we know, in our experience working with partners, we have heard, we have seen are direct and significant challenges to those communicating about youth mental health. And so the first of these mindsets is the mindset of individualism, right? This is the implicit assumption that the world is the way that it is as a result, as an exclusive result of how hard people try, the decisions that they make, the will that they do or do not choose to exert. This is what is kind of classically called bootstraps thinking. And the idea here isn't that this is wrong, right? Individual decisions, choice, willpower, all those things that I've said matter a great deal. But it's the way in which thinking in this way leaves a whole bunch of other things that matter, resources, support, relationships, interventions, out of the picture. And so when people apply this individualism mindset to thinking about youth mental health, there's a couple of really kind of dangerous and unproductive things that happen. So first of all, when thinking individualistically, when thinking in terms of that individualism bootstraps, people put responsibility for mental health conditions and outcomes on young people themselves. So the role of society, the role of resources, programs, interventions, supports, all these things that we know matter a great deal and that are kind of our lever on this issue to pull, fade out of consideration and aren't in people's view of what's happening here and what matters. And what that does is that it misguides our thinking about solutions. So if youth mental health is the result of choices and lack of will and decisions that people have made, then the answer becomes people should make better decisions, right? More effort, and not on the importance of resources, supports, and relationships. And what this does, kind of at the end of the day, is that it really powerfully keeps people from seeing youth mental health as a public issue and makes people see it as a personal or private issue. And the really interesting thing is that, like, I imagine all of us on this call now are thinking like, yeah, hopefully thinking that makes sense. We wouldn't want to do that. And I would say that the unfortunate thing is that we unintentionally fall into this trap all the time. And so every time we tell what's called an episodic story that's about kind of focuses on an individual's perseverance and will or lack thereof, we cue this mindset, right? We bring it to the forefront and have it be the lens through which people are interpreting our information. Every time we tell a hero story about that one special person who, against all odds, and it's always against all odds, made the difference, we activate, we reactivate, we strengthen this mindset. Every time we use and emphasize words of choice, control, and decisions in our language, we strengthen this mindset. We bring it to the forefront of people's thinking and have it be the primary lens through which people are considering solutions. So we see this, again, unintentionally all the time. It's in our media. Here's a great example of, again, the intention of this communication is great, but the framing of it is highly unproductive. So people walk away from this thinking that mental health is really all about individual decisions and responsibilities that we have and exert over our own mental states. The good thing is that there is a counterbalancing mindset to individualism, and it is this sense that what surrounds us shapes us, this sense of contextualism. And the framing move that we want to do here is we want to move away from those practices that I just talked about on the previous slide, and we want to move towards a set of practices that cue this sense that what surrounds us shapes us. So what we want to do is we want to tell stories not just about people. Yes, they have to have people in them. A story without people is not a story, but they should have environments. They should have relationships, other people around the person. They should have supports as characters in the story, as things that are making things change. We want to explain deeper causes, the things in our society that are leading to youth mental health problems, and show how they can be addressed. And wherever possible, and this was really awesome framing in First Lady Cox's comments at the beginning, we want to highlight efforts that have been made that change the context of support and that have resulted in improved youth mental health outcomes. So the litmus test that we can use across all of our communications is, if someone can walk away from our messages thinking that individuals are completely and solely responsible for the cause and the solutions for youth mental health, that is not a message that we want to advance. The good thing is that there are messages that kind of cue this contextualism, this what surrounds us shapes us all the time. They're out there. And what we need to do is have more of these kinds of frames and less of the kind of individualizing frames that I just showed you. So the second mindset, and then I'm going to hand things over to Marissa, that we've seen as a real barrier to engagement on this issue is the growing, the pervasive, the powerful sense of fatalism in this country. That is the sense that there are too many, too dire social problems for us to do anything about. And when we're presented with another one of them, youth mental health, we quickly tune out and turn off the message and disengage from whatever comes next. Clearly, this is a problem in our thinking about youth mental health. It saps energy from awareness building efforts. As soon as someone is saying yet another issue that can't be solved, anything that you're trying to engage them on after that is a losing endeavor. Second, it has a potential backfire effect. If we are able to lean on fatalism to increase awareness, we might increase awareness, but we do so at the expense of efficacy. We can get people to think that this is really, really a problem, but that doesn't actually lead to engagement. That doesn't actually increase support for the kinds of solutions that we want to mobilize. And unfortunately, the list is long of all of the ways that we fall into this trap. When we use crisis language, when we use dire stats about prevalence without solutions, when we focus all of our time on mental health problems without talking about mental health, we fall into this pattern. When all of our examples are about only the most dramatic and violent cases, we fall into this trap. And again, I don't need to tell you, I needed a bigger slide to fit all of the ways that even a short look at the media attention to this issue falls into this trap. So luckily, like individualism had a counterbalance, fatalism has a counterbalance. And that counterbalance is this very strong strain in American culture of pragmatism, problem solving, and progress. And what our work needs to do is it needs to be attentive to urgency, but also to this other concept, which is called efficacy, the extent to which people can see a problem as solvable. And there is fantastically interesting research out there that shows that when the balance between urgency and efficacy is overly weighted on the urgency side, right? When it's those headlines I just talked about, and with low or no efficacy, the result is peace, I'm out, right? You've just shown me another big bad social problem that I don't know anything we can do about, and I'm gone. Unfortunately, the answer isn't just to go all efficacy, all solutions with no urgency, because when we do that, the result is snore and bore. People know there are dire social problems, and if you've got one that you've got a handle on, then people aren't with you. The magical balance is when we're able to achieve kind of robust senses of urgency with robust senses of efficacy, that this is a problem, but that there are solutions. And again, I think this was really carefully titrated in First Lady Cox's comments at the beginning. But when we're able to do that, we achieve these kind of magically persuasive messages. So the recommendations here are really around how do we hit this urgency and efficacy balance in what we're doing. So first of all, like, we need to make sure that solutions are in our messages. We need to make sure that we don't put out any communications that are completely absent when it comes to solutions. We need to activate these values, these counterbalancing values of pragmatism, of problem solving, of innovations that counterbalance this really strong sense of fatalism in our culture. As I said, we need to tell a lot more stories about health and not just threatens it, and not just what threatens it. And that does not mean that we get Pollyannish and kind of falsely positive, but we need better balance, which is my last point, which is not to go all in on solutions without that grip that urgency provides. And I would just end before I hand things to Marissa with the fact that these recommendations are not, we don't mean to suggest that these are things that aren't being done, right? These kinds of messages exist and are out there. You can see the Surgeon General's communications here, which I think is a fantastic balance between urgency and efficacy. There's this article that we found, I think this is in the New York Times, that I'd probably take out the word crisis if I could, but does a really nice job of having that urgency and that grip that pulls people in, but presenting people with a concrete solution that works to get them to come along with us. And with that, I'm going to hand things over to my colleague, Marissa, who will take on the third, last but certainly not least, otherism.
Great, thank you, Nat. So I think that, the third most important mindset that we want to talk about today is otherism. So this is really based in a kind of fundamental way of thinking in our cognition, which is this sort of us versus them thinking, that there are groups of people who are different than we are and are therefore other. So let me get a little bit further into that. So what otherism does to our thinking about youth mental health is that it sets up this dichotomy between their problems as young people and our problems as adults. So young people's needs are different from the rest of ours. They can't really be addressed particularly well because adolescence is just a particularly difficult time of life. And so policies can't really do that much. And so this creates that low support for policy. On the other hand, it can also backfire. So it can, when we are raising awareness around youth mental health, in addition to kind of creating the salience around it, it can potentially create more negative perceptions of young people as, struggling with mental health, as problematic, as we're going to see in a moment, an example that I have, as needing to essentially be separated from others, and as unable to help themselves. So the stigmatization and dehumanization that can occur if we're not being really careful with our communications around youth mental health is something that we want to think about because it's really important. So the ways in which we fall into this otherism trap, and there's a number of them. The first one is vulnerability, which actually, as we saw earlier with child mental health, it has a similar issue, is in that it makes people feel pretty fatalistic, and like this is a time of risk and vulnerability, and young people just need to kind of go through this, and there's not much that we can do about this. It also, another part of the messages we often see is about, again, young people not being able to help themselves because they are so vulnerable, which takes away from their agency and makes it difficult for people to recognize that young people can and should be part of the solution in addressing youth mental health. Using they, them, and those language, which again just suggests that they're other, they're not part of us, part of our society, part of our sort of part of adulthood, even though they are becoming adults, and treating them as a uniform group. So young people who have mental health challenges are essentially all the same, are facing the same challenges, lumping them together instead of recognizing that there are different types of needs, and also othering them from other adolescents. So those are the different ways that we can fall into these communication traps that are really problematic and othering. So this is a specific example of that. And this is a type of communication that actually, when I was searching for an othering communication, I found all over the internet. The picture, that icon, that picture in particular of the young person who's kind of holding themselves in and is extremely vulnerable looking, is just totally pervasive when you're looking at any sort of data sheet or picture of a young person who might be struggling with mental health. But it's not just the pictures, it's the icons and it's the data. So the data is put out there in ways that are meant to be very, very alarming, but are not contextualized in any way, and definitely don't point to any sort of solution. They're just sort of a litany of bad things. And then even to the extent that it talks about high school dropout rates and rates of committing crime, which further others young people, and again, like, leads to this fatalistic, we can't help them, they're sort of outside of our society in some sort of way, and creating these very alarming statistics. So I think this is a particularly egregious example of this type of communication. So how do we counterbalance this otherism mindset? And it's with a mindset around collectivism. So the way that we can cue collectivism and push back on that otherism is we have several things we can do here. So one is using values of interdependence and collective responsibility. And actually, when First Lady Cox talked about connectedness, that was exactly, this type of communication value that you can use in a really effective way. I was really happy to hear her say that, actually. And this is the idea that, as a society, all of us rely on one another, and we're all responsible for each other's well-being. And that includes young people, and that includes young people who have mental health challenges. Another way is to watch our pronouns, use that we, use that us, use that our, and avoid labeling young people in particular ways that again, other them and create a sense of fatalism. Talking about common experiences is very important. Every adult on this webinar period has experienced being an adolescent, right? So there's a lot of common ground that we can emphasize and prevent that sort of, oh, they're in a separate category going through a particularly difficult time of life that we're not connected to. We are connected to it. And finally, making sure to always include young people as active participants in their own lives, and also as part of their communities, right? So it's not just that they need to be protected from themselves, they can be agents. And I'm going to show you some examples in the next slide of the ways in which young people are active agents and are connected to their communities. So I really love this slide because it has so many great examples of the various ways in which young people are connected, are helping each other, are helping their communities and the rest of us in society. And these are not the only stories. There are actually quite a few of them, I think, that came out during the pandemic about the ways in which young people were supporting each other around youth mental health, but also just more broadly. And so, looking for these kinds of communications and how can we leverage them? How can we leverage these stories, I think is really critical in combating otherism. So these are the three mindsets or the three cultural myths that are challenging our communications. And just to dig a little deeper into that is a quote from John F. Kennedy that I know Nat loves and I've grown to love, about this challenge around cultural myths and around understanding. And it's the idea that, people are not out to do wrong and bad things. They're not out to make the world a bad place for adolescents, but the ways in which we see the world, the myths that we bring into any conversation or communication or anything we hear about adolescence, the individualism, the fatalism, the otherism, makes it really hard for people to understand the ways in which the world works and how we can change it. It makes progress difficult. So when we address these myths, we can actually change things for adolescents. We can support adolescent development. We can support youth facing mental health challenges by understanding those myths, those persistent, persuasive, unrealistic myths, and understanding how we can counter them. So in the next couple slides, I'm just going to show you some examples of what we can avoid, which is implicit in what we've already talked about and what we can advance. So the things, just to remind you, that we want to avoid is making mental health an individual problem that has to be solved by individuals. Using crisis language and creating that sense of fatalism, and also that sense that, this is one crisis amongst many. So why do I need to turn my attention to this, or what can I possibly do? So that balance between urgency and efficacy is really critical. Litanies of stats, unframed data, like we just saw, can be so incredibly problematic. It's setting up that kind of crisis, even if it doesn't say crisis, and hoping to create awareness, but then it's backfiring a lot of times. Portraying young people as victims that need to sort of be protected and encircled, and they're vulnerable, but not giving them any agency is really problematic. And then further othering them with that they, them language. And then some things that we can do to advance, because it's always important to have solutions as well in various ways. So the first is contextualize mental health. Use examples, use stories that show the ways in which surroundings influence mental health for young people. Always offer solutions. That's so incredibly important. Context. People need the context, but they also need to know what it is that needs to be done and see themselves in that solution. Using values to open the door to productive conversations about youth mental health in the various ways that Nat talked about, that First Lady Cox talked about, that I did to counter fatalism, including that we rely on each other, right? And we have a collective responsibility to make sure that all young people are thriving, and making it clear that young people are part of the solution. They are not helpless. They need to be part of the ways in which we address youth mental health and create better well-being for all young people. So I'm just going to end with this final quote from Charles Eisenstein, which all of us at Frameworks really like. The world as we know it is built on a story. To be a change agent is first to disrupt the existing story of the world, and second, to tell a new story of the world so that people have a place to go. So I think now we're ready for questions and discussion.
Yes, thank you so much for that wonderful presentation. So I know we have a couple of states here who have been making big strides on youth mental health. So I'd love to hear some perspectives from folks about, how this is going in your state, or, any questions that you might have for our fantastic presenters, Nat and Marissa. And while you guys are all getting your questions together, I wanted to turn this question over to Delaware First Spouse, Tracy Cullen-Carney. I know that she had submitted a question and wanted to turn it over to her.
Thank you. Thanks for including me today, and thanks for a great presentation. It actually made me feel pretty good about what we're doing in Delaware. I think we're doing some of those things pretty well. I'm not sure about others, but we'll get there. My question speaks to one of the points you made over and over again, which is, how have you included young people in the research that about framing? How are their voices reflected in what you've presented today?
That's a great question. Marissa has largely led this work. Marissa, maybe I'll let you take that one. I think we have an answer to that, which is good.
Yeah, so in a couple of different ways. So in the initial research that we did specifically around adolescent development, we included young people in the research around finding out how people are thinking about adolescent development, and found that there were some differences in terms of how adolescents think. I think in particular, not surprisingly, in terms of thinking of themselves as having more agency and being able to address problems. Although interestingly, still there is a lot of overlap with adults as well. I think bringing the work out into the world, both with the adolescent development work, but also we did a large project on transition age foster youth, is working directly with young people to help equip them with the framing strategies that we have, and learning from them about how they would actually use those narratives. So not just saying, oh, here you go, here's your framing strategy, but also hearing from them, when I tell my story about my situation or the situation of others, this is how I could see integrating those framing strategies. I think something that's really, and some of the young people I've talked to have responded that this is actually really important to them as a tool, is that when you have a narrative or framing strategy that is not specific to stories, which a narrative kind of comes above, a narrative is informed by stories, but also creates sort of the meta story in a way. You can use that without a young person having to tell their own personal story if they don't want to.
That point was exactly one of the things I had in mind. Abby Cox actually and I both participated in a group of first spouses bringing young people to DC last fall. And one of the comments, they had a chance to meet with the cabinet secretaries and some other people. And one of the comments that stuck out for me was a young man who said, "Thank you for not making us talk about what happened to us in order to justify our seat at this table."
Yeah.
So thank you.
You're welcome. Yeah, I think that that's so important that young people have those tools, and just knowing that you can tell your story, but in a different way than having to totally reveal your personal feelings or experiences or trauma is really critical.
And just to build on that, like how infrequently that happens, how the practice and the pressure of the nonprofit community is to kind of push young people or other people with lived experiences into positions where they're compelled to tell their story, even if they may not want to. So I think that just to plus one that question and your answer to it, Marissa.
We have one question in the chat, which I want to get to from Jen from Wyoming. But I also wanted to turn it over to Ohio. I know we've talked with you extensively about how this work has been going in Ohio. We just wanted to see if you had any thoughts to share about how you've seen this messaging impact how youth mental health policy has resonated within your state.
Thanks, Jordan. My name is Kara from the state of Ohio. I'm with Governor DeWine's Office of Children's Initiatives. And I think we've all had such a focus on behavioral health. I want to thank you for this presentation, because I think what it did for me, although we've been really focused in this space and really hitting our K-12 area and making sure our districts had enough flexibility to meet their students where they are, but also coming up with some consistent messaging. What you reminded me of today is to not be transactional, and that standing up a program isn't enough to get kids to buy into it. It's relationship based and it's voice based. And I think the last question also brought up kind of one of the questions I wanted to pose to you all is, I feel sometimes like we survey our youth to death, because as a political office, we have to be able to justify any investments and the return on investment. But we're also trying to balance that with exactly what Delaware said. We don't want the youth to have to continually tell their story. Have you guys seen any models that work from the standpoint of ongoing communication? We've done a lot of work in human-centered design, which has been incredibly enlightening, but it does focus on lived experience. So I didn't know if you had suggestions on ways state could maybe lean into ongoing. Is it an ombudsman office or a youth voice group, or are there thoughts in that space?
I mean, there's so many different organizations now who are doing different versions or sometimes shared versions of bringing together young people to actually inform the work that they're doing and policy. I actually had a call earlier today with the Center for Law and Social Policy around their Changemakers organization, which is focused on a New Deal for youth at a federal level. And they're doing, I think, some really interesting work, and I've spoken to them. So I think I don't know, there's a lot of different models out there. So I don't know how super helpful, but that just jumped to mind because I was speaking them today.
I think anything out of the box from the suggestions or leaning into what others already have out there is helpful. So you're not constantly having the regurgitation of stories. So I think that that's a helpful point. And I see some of the other states are also pointing out youth advisory groups. So appreciate this context though, because I do think we get so wrapped up in the mission of standing up our programs and pushing our transactional information out that we sometimes forget how it's received. And I think you guys did a great job of laying this out. So really appreciate those helpful reminders as we continue to move forward with standing up even more in this space.
I might just say one thing as a response. I think voice is different than power and agency. Like hearing from someone isn't sharing power. I know that's a little wonky, but I mean, I think a lot of the work that Marissa is involved in, and I'm not saying that this is what you were saying by any means. I'm just saying I think it's important that we really push on this concept of agency and kind of get past the focus on voice. And so agency to me really involves, it really is a concept of power. And voice is really a concept of representation or being heard. And so I just to be a little provocative here in how we're thinking about how we involve youth. And I think kind of the trajectory or the history has really been around voice. And I think I'm seeing in the work that I do, kind of more of a shift to thinking about agency and power, which I think is a really interesting, not uncomplicated, but a really interesting kind of move.
I think you hit a great point. It's almost like being data informed versus data driven. You can't just hear it, you got to actually use it. So I know there's other questions, but I really appreciate your time this afternoon. This has been helpful.
Thank you, Kara. Wanted to quickly touch base on a question that came into the chat from our friend Malia from Hawaii. who asks, how do we work with youth leaders to shape their messaging so as not to offend the establishment? We end up taking down their social media posts because of the language that was anti-tourist. Any thoughts there?
Marissa and I tend to like wait out the really hard questions and see who can wait longer. I'm horrible with silences, so I lose every time. I don't have an answer. I just, my response to that is that all of this stuff we've been talking about is really complicated and exists kind of like on a continuum. And all of these decisions need to be carefully calibrated to the context of the communication, to who is the messenger and to who is being messaged with or to. So Malia, I don't have a great answer to that question. I think that there are ways in which if youth are given voice and power, there are other interests that aren't always advantaged. I don't know if that's the right way of saying it. Marissa, I don't know, as I've babbled here to buy you some time to think, I don't know if you've got anything else to add. I think it's a really good question. Clearly, I don't have a really good answer, but I really appreciate you raising it, Malia.
Yeah, I mean, I think that at least from our perspective, it is a matter of roles. Like the folks that are focusing on policy and organizing young people, what we can bring to the table is what we know about how a message could potentially backfire or potentially land, and then helping craft the communications in ways that we know will have impact in the ways that we want it to, right? It's not just about raising awareness, it's about increasing people's understanding so that they have support for, we're creating support over the long term. But in terms of like the actual sort of organizing of the young people, I don't think that we have much expertise, and you all would have like a community of practice and be able to talk to other folks about how to do that better than we could.
Thank you guys so much. And thank you, Nat and Marissa, and thank you also to our funders of Adolescent Science Translation, FAST, who made today's presentation possible. So as we come up on our time here, I just wanted to say again, we'll certainly have this, this presentation up on the website, and we encourage you all to leverage this and any other resources from Governor Murphy's Chair's Initiative on Strengthening Youth Mental Health. As a reminder, this initiative is just the first step in mobilizing governor's leadership. So please stay tuned for our playbook with specific actions to help governors build platforms that center on youth mental health. This playbook will be released in July, and we're very excited to support you all as you launch these policy initiatives moving forward. Thank you all so much for joining us today. And if there's any other additional questions, we are happy to facilitate getting those answered by Nat and Marissa and the team at Frameworks.